Afternoon, everyone. Bon après-midi, tout le monde, and welcome to our first Zoom teleconference with my daily brief. I'm just going to give you a bit of an overview of where we are and some of the things that are happening at the health unit and what we're doing to prepare going into the long weekend ahead of us. Essentially, just going to give you sort of a worldwide, as you know, there's almost 1.35 million cases now worldwide with about 75,000 deaths, 400,000 cases in the United States with about 9,000 deaths, and half of which the cases are mostly in New York State. In Canada, we've had about 16,500 cases with 120 deaths. And we've had in Ontario, we're up to 5,276 cases with 500 deaths with 174 deaths, but 500 new cases since the previous day. We're, in terms of testing, there overall across the province, there's about 614 tests pending. We're able to, the labs are now have caught up and are able to increase their capacity. So that's good. From our point of view, in terms of the health unit statistics locally, our numbers, we just went up today, are up to, as of today, right now, we're up to 47 cases. I can tell you that from that, we have 3 individuals that are in hospital, 3 individuals that are in the intensive care unit, and 1 that's not. So we have 4 hospitalized individuals. We do not have any deaths at this point. I know that we've had a lot of calls from people. We don't have any confirmed deaths at this point. We're in terms of looking at our curve, we see that there was a peak kind of in the middle of March, but we're still getting some cases. And as I said last time, our curve itself really shows you that it's day of onset of symptoms, not day of the test. We're continuing to test. We have our facilities open. Castleman is open this week. Our Rockland Assessment Center open for testing in partnership with the Rockland Family Health Team. We're continuing in Hawkesbury. We're continuing in Cornwall. We're continuing in Winchester to do the testing. At this point, like I said, our major challenges moving forward are ensuring that we continue with the public health measures. We have been getting some concerns locally that still people, particularly in the Cornwall area, are going to grocery stores. We've had kids playing in parking lot in playgrounds together. We need to ensure that individuals heed our warnings. The other question that keeps recurring, and I'm begging you to help me, the media, is, we've had, by the end of the day, we're probably going to have 50 cases because we get cases trickling in. And people have been bombarding us with emails and tweets and other social media questions about where exactly are the cases. They're everywhere in the East Ontario Health area. They're in Cornwall. They're in SD, all corners of SD&G, all corners of Prescott Russell. They're everywhere. And so, if we say that, and I can tell you it's in dozens of places, not just one, dozens of places, and including Cornwall. Cornwall does have cases as well. So the reason I'm hesitant to give the exact details of where they are, because I don't want people to be complacent. Their towns are so close to each other. If one little town doesn't have it and the next door does, I don't want that first town saying, well, we're okay. We need to understand that it is in our area and we need to behave as such. And so we keep sharing that message moving forward. The other thing too is that we've been working with grocery stores. The grocery stores and retailers have been more and more compliant, helping us. A lot of them were to begin with, but we're working with them to ensure that they have the proper mechanisms for crowd control, proper mechanisms for ensuring their infection control procedures, both to protect the customers, but also to protect their staff as well. We've also had some concerns regarding what's coming up over the weekend. Easter weekend is around the corner. We've had individuals go shopping and shopping, big turkeys and all kinds of things, and hopefully they'll eat them at home and not have guests over. So it's very important for us right now. We're really at the level where we have to continue with our messaging, which is really to ensure that these measures are respected. We want people to take it seriously. It's important for us. In our area so far, like I said, I also must say that we always say that, and I remind everybody, we have a large senior population. We have a population who are vulnerable in terms of chronic medical conditions. We have a higher rate of those, and those are the individuals that are vulnerable. Our long-term care facilities we're monitoring them. At this point, we don't have any COVID outbreaks in long-term care facilities, but we're working with our long-term care facilities, our retirement homes, to make sure that they take all necessary precautions to ensure that the virus doesn't get in to their organizations, because we've got multitude of, I think, 83 cases of long-term care outbreaks of COVID-19 in the province. And a lot of the deaths are, unfortunately, in that population, because they are most vulnerable to these types of infections. And it's not only to the COVID-19, but every time we have an influenza outbreak or other respiratory outbreak, we tend to see them congregate. These viruses tend to congregate and single out seemingly these individuals. So those are the types of messaging that we're looking at. We're now, like I said, working with our hospitals. There's a PPE issue, personal protective equipment. Our hospitals are close to running out. They're not running out yet, but we had some good news from the ministry that a big drop of PPE was sent to the Ontario province, and hopefully we'll be getting some news as to how we can roll those out. In terms of other issues, we just, as I said, we just continue. Our IMS team is working with the municipalities. We are sometimes we do know that there are some concerns, particularly along our border area in the Hawkesbury, Alexandria, and Cornwall area, particularly on Sundays when in Quebec they close all grocery stores. We seem to have a big influx of Quebec plates coming into the area, filling up the parking lot, making it difficult to do social distancing. I've been approached by MPs, MPPs, mayors. We're talking with the ministry. We're looking at ways that we can dissuade individuals to come over. Again, this is a very complex issue, but we are very well aware of that. We know that it will likely not be an issue this weekend, because on Sunday, I presume most of the stores are going to be closed because it's Easter. But we are looking at that. We are quite aware, let's put it this way, that we do have this influx of individuals from Quebec. And so we're looking at what options we have. We're talking with police, we're talking with ministers, we're talking with the Ministry of Health, we're talking with our MPs and MPPs in that regard as well. Bottom line, again, weekend's coming. I plead to people not to take the temptation to go visit grandma or have gatherings. Stay home, stay safe, and we'll hopefully, like I said, see some progress. And we are, like I said, from our point of view in our health unit, I'm just looking at my questions here. I'm just going to log on. From our point of view, if we look at the way that our numbers are, we are sort of flattening up. We do get the cases coming in, but we had a bit of a peak. Hopefully our peak is over, but we can't rely on that. We can't just say, well, our peak is over. We still have some time to go over the next week or two until we kind of make sure that we've collectively flattened that curve. We are working with Akwesasne. Akwesasne is another one of our partners, and they're part of our management team now in terms of their health department, and we're working with them as well to be able to help them trace. They have not had any issues on the Canadian side, but we're keeping in touch with them. We're keeping in touch with New York authorities as well, because again, we have that cross-border issue. So again, message is stay home as much as you can. Only go out for essentials. Take a walk with a dog, and that's it. Really stay inside. Don't go to playgrounds. Don't go gatherings. Don't go gathering in the parking lots. We've had reports of that. I must say, though, that, again, our retail stores have responded. A lot of them are now putting in the measures. But it's also a lot of the public that are not heeding to those measures. So, for example, if there's marks on the floor, or if, for example, there's a limitation of how many people could go into the store, people should be waiting outside patiently and with a distancing as well. But again, necessary trips to grocery, pharmacy, fine. Medical, if you need a medical appointment, that's fine as well. But stay home as much as you can and work from home as much as you can. I have some questions here that I'm going to put up that we got already before the briefing. Total number of ventilators in our territory. I can tell you that access, the only hospital that ventilates is Cornwall in our area, and they have 14 ventilators to their disposal. Right now, they're using 2. The whole Champlain region area, because there's a pool of ventilators that could be shifted from one hospital to another, is around 200 or so. We're way below that capacity. We're way below that need at this point, and provincially as well, we're way below our capacity. So that's one question that I had. Another one here: are there any opportunities to volunteer at the health unit? For example, assisting in contact tracing. We do have contact trace volunteers. They're actually being provided to us if we need them through the Ministry of Health, through medical schools and nursing schools across, because we need to have a bit of a medical background for that. The other question is actually a very interesting one that Nelson from Nation Valley News. Without a vaccine, in the long term, is it possible to maintain a lower infection rate within the local population below that of the rest of the world? Realistically, can Ontario and Canada emerge from this pandemic with smaller percentage population that have been exposed to the virus, say the United States or even like India, again, in the absence of a vaccine? Can we avoid being dragged down to the common denominator level of infection as a global phenomenon? That's a good question, Nelson. As a matter of fact, I was talking about that yesterday with some of at the ministry level when we're having our weekly teleconferences, and it's a matter of, what you're asking is really what percentage of the population can we get away with and have this pandemic over? And the question is, when will it become so? When can we? What number? What's our level? Can we maintain it low? I can tell you that likely we will not be able to maintain it low. But the thing is that over time, you want to spread it out over time. You don't want to get everybody infected at the same time. In the absence of vaccine. So that's why we're saying it's dependent on how we cluster, how we close in, how we self-isolate, and so on, to what extent the virus can, infect, 70% of the population or whatever projections are. Because it all depends on that. And then the other question that's related to what Nelson had asked was, are we looking at a second wave or a third wave? And again, that too depends on the behavior of the individuals and how much we may ward it off now, and then progressively start letting people get infected over time, because we can't prevent it. The virus is going to be there. We can't, in the absence of a vaccine. At one point, there may be slower, lesser second and third waves, and that's dependent on what we do. But the bottom line is that I don't think we can prevent a lot of people getting infected over a period of time. Our goal is to ensure that that period of time is as long as possible, so that it happens, and then once we reach a level of like herd immunity, where a certain percentage of the population is infected and the virus doesn't have a chance to go around, at that point we'll be able to say, okay, we're better off. But the trick is that we need to make sure that it's kind of like doesn't peak and go up and down. It kind of slowly infects everybody. Majority of people will not have severe symptoms, but again, for reasons of not overwhelming their healthcare facilities, we want to keep it going flatter. So that's essentially what you're asking is really how much can we spread that infection rate over a long period of time to flatten that as much. In other words, to have as least possible growth of number of daily cases over a longer period of time. So that's how I'm going to answer that one. So yes, eventually we will be dragged down with numbers, but what they're happening in the States is that they're happening skyrocketing. We don't want that. We want it to be flat. J'ai une autre question en français. Est-ce que c'est possible d'avoir des données régionales? Combien de tests ont été émis? J'ai pas tous les figures encore au niveau des tests. Je peux vous dire qu'à Castlemaine, on a fait au moins 150. On a une autre centaine qui a été faite cette semaine à Hawkesbury, mais je vais vous retourner à ça. Combien sont-ils positifs? Jusqu'à date, on a 47 qui sont infectés du COVID. Combien ils sont-ils remis? Je peux vous dire qu'on a à peu près dans les 47 que nous avons actuellement, sûrement 9 à 10 sont complètement résolus. A-t-il un décès lié au COVID-19? Non. Jusqu'à date, on n'a pas un décès. Le dernier cas identifié positif a été à quelle date? En effet, le dernier cas, on a identifié ça il y a 2-3 jours. C'est parce que la façon que nous mettons les cas sur nos sites web, c'est pas le jour qu'on fait le test, c'est le jour que cette personne qui était positive a commencé les symptômes. Parce que des fois, on avait un délai de quelques jours. Donc, je pense que c'est mieux d'avoir quand est-ce que la personne était malade. Donc, je pense que selon le dernier que je veux, la dernière était soit le 3 ou 4 avril qui avait ces symptômes, malgré que nous avons reçu les résultats soit ce matin ou hier soir. J'ai une autre. OK. Puis on a ici Radio-Canada. Est-ce que vous êtes en mesure de confirmer non, on n'a pas une première mort. Non, je n'ai pas d'autres détails parce que je ne peux pas vous donner des détails parce qu'on n'a pas de mortalité. Je peux vous dire qu'on a 3 personnes en soins intensifs, mais on n'a pas de décès. So we don't have any deaths. The question was, we have any deaths? So I will leave it to questions now. Hopefully we can unmute. So do we have James there? Let me see if I can unmute you. James is unmuted. Go for it, James.
Hello, doctor. Nice to see what you look like.
You haven't seen me on TV. I've been on CTV and CBC almost every day.
I don't have cable or satellite. Anyways, one question is, we hear about the short supply of protective equipment.
Yeah.
How much is there usually on supply in a normal time?
Normal times, I can tell you, there's a provincial stockpile for at least 3 to 6 months. At this point, it's been depleted, and so ordinarily we'd be expecting, we'd be able to dip into that, but there's been such a demand that we've not been able to replace that stockpile because of international issues. So usually there's a couple of months worth provincially, so as an emergency backup.
And, okay. I understand there is an outbreak in a group home in Plantagenet.
Yeah.
And there is coronavirus at a long-term care facility in Hawkesbury.
Yeah.
Are you able to tell us how many specific cases there are there, or?
I can tell you, first of all, the coronavirus in Hawkesbury is a usual coronavirus. So if you look at our website, you could see that when we do outbreaks, we have there's coronavirus, there's RSV, there's influenza. So that is not the same as COVID-19. It's the usual coronavirus that spreads around. One of the homes does have, when there's more than one case, we declare it an outbreak, and we're following that one up, and we're doing all the contact tracing and so on there. So it's only one, it's not two, it's only one, and it's a group home. It's not a long-term care facility. It's not a retirement home. Okay?
Thanks.
Thank you. We have any other questions? Who's next?
Oui, est-ce qu'on m'entend?
Oui, allez-y.
Oui, Jérémy Bergeron de Radio-Canada.
Oui.
Je remplace Denis qui est occupé aujourd'hui, visiblement sur autre chose. Ma question, donc, j'ai entendu, je veux juste avoir des précisions, j'ai entendu demander qu'il y avait un afflux de gens qui arrivaient du Québec. C'est quoi ça ou juste, pouvez-vous juste m'expliquer le contexte?
Je vais dire en français. Écoutez, les dimanches, comme vous savez, à Québec, les magasins sont fermés. Sont fermés à cause du COVID. Et qu'est-ce que nous avons vu la semaine passée? C'était dimanche passé à Alexandria, à Hawkesbury et à Cornwall. Les centres d'achat ou les magasins, le stationnement était plein des autos de Québec parce qu'il n'y avait pas de magasin, donc ils venaient ici pour acheter. Donc, ça aide pas à nos efforts à diminuer la distance. Si le stationnement est plein, c'est très difficile à avoir 2 mètres de distance entre les personnes. Et c'est pour ça que nous avons les gens qui demeurent à Alexandria, les maires, le ministère, etc., étaient un peu pas fâchés, mais déçus parce que nous essayons de façon étroite de diminuer l'entrée au magasin comme les épiceries, etc. Et si on a des douzaines des autos dans le centre d'achat, ça rend cette tâche très difficile. Ça, en effet, c'est ça le problème qu'on avait. On ne va pas l'avoir dimanche prochain parce que c'est le Pâques. Donc, on ne pense pas que tous nos magasins vont être fermés ici. Mais dorénavant, mais la semaine prochaine, par exemple, donc on est en train de voir qu'est-ce qu'on pourrait faire pour peut-être diminuer ce type de trafic. Parce que ça rend, comme je vous ai dit, ça rend nos processus, nos mécanismes, nos procédures à diminuer la contrôle, à diminuer les infections, etc., ou mettre les mesures en place pour contrôler l'infection, ça se rend plus difficile. C'est pour ça.
Est-ce que ça pourrait qu'on fasse des barrages routiers un peu comme le Québec fait en Outaouais? Est-ce qu'on
C'est une question qu'on se demande. Est-ce qu'il y a d'autres moyens à le faire? On est en train d'en négocier ça. Avant que j'ai commencé ici, j'étais sur téléphone avec le ministère de Santé, le ministère de Santé à Toronto en disant qu'est-ce qu'on a les choix, qu'est-ce qu'on pourrait faire. On en discute aussi avec Francis Drouin, avec nos MPP aussi, pour voir qu'est-ce qu'on pourrait faire de façon, parce que c'est un aspect interprovincial. Ce n'est pas tout à fait de santé, mais d'un autre côté, ça peut affecter la santé aussi. N'oubliez pas que Québec, on a double les personnes qui sont infectées qu'en Ontario, avec la moitié de la population. We have another questions? Any others?
Yes, Dr. Paul, Nick Seabrook, Seaway News.
Yes, go ahead, sir, Nick.
Just following up on James's question about the PPE, are you able to tell us, say, Cornwall Hospital, how much PPE they have left?
I think they have about what I'm hearing is probably another week or so, a week or two maximum, and so that's why what we're doing is in the interim, hoping that we will, and I'm confident that we will getting some beforehand. But in the interim, what they're doing is we have processes now of collecting all used PPE and looking at mechanisms to sterilize them and reuse them. That's a last resort, but I'm confident from what I heard before that we will be getting PPE supplies quite shortly. So we're crossing our fingers, but I also think that we will be getting it shortly, so that there'll be that relief that we need. Yeah.
Oh.
Yeah, I think I answered that before. I was one of the things that's happening is there may be room for volunteers. There is actually a mechanism for us now to tap into medical students and nursing students initially to be able to use them as volunteers. At this point, we have enough of our staff doing it. We've redeployed a lot of our staff just doing that. But at some point, there might be a need, and we will do a call out. But we do have at this point literally hundreds and hundreds of volunteers accessible to us through Health Canada and through the universities and colleges, both medical students and nursing students as well. So there might be a call. At this point, we don't need them at our health unit, but I know that other larger health units are already taking advantage of that. Thank you.
Dr. Paul, it's Francis Racine calling from the Standard Freeholder.
Yes.
I spoke today to a business owner in Cornwall who received quite a big fine for not following some of the procedures that the Eastern Ontario Health Unit has imposed. And he told me that he felt that he did not get enough communications from the health unit regarding that. Can I get your comments on that?
Well, first of all, what we try to do is we try to work with the agents, with them, with any of the retailers to see what is the problem if they can't comply. And we usually take an approach where we would essentially work with them to see, okay, what can you do, and give them a bit of a warning. So I can't comment on that individual one. But the general approach is really, if there's an issue, we call them, and we've been calling groceries, we've been calling a lot of the retailers on a regular basis and answer their questions. And some of them say, and for example, some of the smaller retailers may not have the capacity to do, for example, X, Y, and Z. But at that point, we'll work with them and see what's logical. Our end point here is not to find people. Our end result here is to ensure that we put the measures in place so people can shop safe. Customers and also the staff are safe. So I can't really comment on that one. I'd welcome speaking to the individuals to see what happened. But again, it shouldn't be our first resort, but I can't comment on that specific case. I'm not aware of it. I do know that, however, we've asked police and bylaw officers to help us as well, because it's such a big territory, and they're helping us as well. So, we do get, like I said, calls coming back. Well, this individual wants to do X instead of Y because it's impossible to do that. So it's not one size fits all. So we definitely that's not the typical thing that we want to be doing. But on the other hand, if there was a warning, so I don't know anything else more about that case. Thanks.
Okay.
Any other questions?
Thank you.
Good.
Dr. Paul, I've got my hand up. I wasn't sure if you saw me or not. So
there you go. I see you now.
So I have a question, and it's regards to in South Dundas. I've received 2 different contacts from people in South Dundas about a campground that has started to reopen for snowbirds returning. And the reports were that the people that were returning are not abiding by the 14-day quarantine. There's visitors, there's people out and about, and including license plates from Quebec. And when I contacted the South Dundas Bylaw Department, they referred my inquiry to the OPP and the health unit. So can you comment on what the current state of that enforcement is? Okay.
That enforcement is actually part of the provincial, I have the list in front of me, of the provincial designation of essential and non-essential services. From what we know, all campsites, marinas, and everything like that should be closed. There's one exception though, Philip. The exception is that if the individuals who are returning from the United States, in some situations, I think it's the same one we're talking about, if they're returning and it's their sole place of residence, the snowbirds, then we will let them go into that park, but because it's not a seasonal one. However, if they're not abiding to the 14-day quarantine that's at the border, this is a police affair, and this is punishable. This is enforceable. So I would be interested to know, maybe offline, where this is, because again, it's important for us to understand. Like I said, we had that make that, because there is an exception, but by and far, if they're there, they should stay there for 14 days. They shouldn't go shopping, and so for them, the federal quarantine order applies. Okay. But let's say they were isolated for another reason. Let's say they were tested positive here and hadn't traveled and were living there, let's say, that would go under my section. There's another provincial order for that. So both ways we're covered. But that's why you'd explain. Now, I can't explain why the Quebecers are there. They shouldn't be there. But if an individual comes back who lives in Ontario and that's their legal residence in Ontario, we can't stop them from going there. Okay. But for seasonal use. But the issue is that they should not be leaving and going out shopping.
Right. Okay.
Okay. Thank you. Okay. I think we're done. It's 4:45. Thank you very much, everybody. I think it worked well. We'll continue doing this. By the way, tomorrow is Thursday. We will have another media briefing. We will not schedule for Friday or for Monday. However, if there's something that we need to announce, we'll have an ad hoc one.